Thank you so much for joining okay, perfect. Thank you so much for joining today. My name is Alexandra Papadimoulis. I am the Training and Coalitions Coordinator for the Injury Prevention and Control Program. Right now, we have a slide on the screen, and it is what part of the state do you serve? Emily is going to be opening a poll. Thank you so much. And just when you get the chance, enter what region you serve in Massachusetts. This just kind of gives us a better idea of where everyone is today, who were able to help, and it's just really great information. So thank you for taking the time. See, we have some people from Western Mass, Central Mass, Southeastern Mass, Boston. Awesome. Okay. Perfect. Thank you. Yeah. So I just shared the results, so hopefully you're able to see them, but it seems like we have a lot of people from Western Mass today, Central Mass, so a little bit of everywhere today, which is really, really great. All right. Folks, are you able to advance the slide? Thank you. All right, so here are some tech tips today. As a reminder, please have your mics muted during today's presentation and use the chat if you have any questions. If at any point your audio isn't working, the button in the bottom for the computer and laptop systems, there's an arrow facing at the bottom. That will be your friend. And then if you need any other technical assistance or support, Emily's email is in that bottom right corner and she'll be able to assist you. Lastly, I do want to mention that today's training will be recorded and it will be able to be shared with individuals who were not able to attend today, or maybe if you want to go back and reflect and relearn some more information. And if you would like the link to the recorded training, please feel free to email me or Emily, and we'll be able to get that sent over to you. Could you possibly advance the next slide, please, Fota? Thank you. All right, so this training, the poison prevention training, is part of our 12-part training series, and this series is designed to enhance your knowledge and overall injury risks, prevention factors, and to communicate these prevention strategies and recommendations to the people you serve. So on the screen, we do have some future trainings that you are still able to register for. They occur on a Wednesday of each month from 10 to 12 p.m. The landing page for the registration that you use to register for this training is at the bottom of the website, on the bottom of the slide. Some trainings do not yet have a set date, but others do. So when you register for that training, you'll get an email for when the registration does open, and you'll be able to get that calendar invite put into your calendar. Next slide, please. Thank you. All right, so we're going to get started with our poison prevention training. It has a bit of an overview of the Poison Control Center, hazards in and outside of the home, as well as protective factors. So our trainer today is Fota. She is the education coordinator from the Massachusetts and Rhode Island Poison Control Center. Which is based out of Boston Children's Hospital. She holds a Bachelor's of Arts in Psychology and a Master's in Public Health from the University of Virginia. Her work at the Poison Control Center allows her to provide these poison prevention educations to people of all ages, not just children, also older adults as well, and conduct analysis of poison prevention poison trends quarterly and annually for the state of Massachusetts, but also the state of Rhode Island. All right, I'll hand it over to you, Fota. Oh, you're muted.
Sorry about that. Hey everybody, my name is Fota and I'm the education coordinator for the Poison Control Center based here at Boston Children's Hospital. This is a training series, a part of the injury prevention series that Alexandria just mentioned. Today's prevention training will provide you with an overview of the Poison Control Center and poison prevention strategies that you can implement in your work and daily lives. And we'll also have a Q&A session at the end with one of our pharmacists. So we have a full agenda today. We're going to start with the burden of poisonings nationally and locally, childhood poisonings, the great outdoors. So we'll talk about cleaning products, carbon monoxide, lead, things like that, medication safety. We'll go over an overview of marijuana, the risk and protective factors, the great outdoors. So talking about things like bites and stings, repellents, mushrooms, berries, different types of plants, an overview of the overall Poison Control Center, educational materials that you can order or request, and key messages, and then we'll wrap up. And then throughout the presentation, we'll have little polls and interactive things we can do to learn. So our learning objectives for today, we have 1, understand the burden of poison nationally and locally. 2, help families and caregivers identify and address poison risk in and around the home. 3, identify resources available to families and caregivers in the event of a poisoning or suspected poisoning. So hopefully by the end of this training, you guys will be able to understand all 3 of these learning objectives. So here we have the risk and protective factor scale. Risk factors are things present that increase the chance of an injury occurring, such as leaving medication, either prescription or over-the-counter meds, in sight and in a child's reach or within a child's reach, or not wearing a helmet when going for a bike ride. So those would be your risk factors right here. Protective factors are things present which decrease the chance of an injury from occurring. So in the case of a medication that is in sight and within reach, making sure that the medication is up, away, and out of sight. In the case of riding a bike, making sure the individual is wearing a helmet that fits their head. So what exactly is a poison? A poison is anything used in the wrong way, wrong amount, or by the wrong person. Poisoning can occur when an individual eats or drinks something, if it comes into the contact with the skin or eyes, or if someone inhales a substance, or if they inject a substance that they're not supposed to. Some reasons for poisonings include unintentional poisonings, such as accidental errors, misuse, environmental poisonings like bites or stings, or even food poisoning. There's also intentional poisoning, which you may know as, a suspected suicide or misuse or abuse, and adverse poisonings or adverse reactions, which can be from medications or other allergens. Knowing this information, please use the chat and provide some examples of what you think may be poisonings. This could be in the home or outside of the home. You can just put this in the chat box. We can see everyone's answers. We'll take 10 or 20 seconds. Yep, seeing some good answers. Bleach, cleaning supplies, mushrooms from outside, plants, meds, carbon monoxide. These are all great answers. Okay, and we'll just go on to the next slide and we'll do some more interactive things. Berries, marijuana. Okay, so yeah, we'll go on to the next one. Thank you for all the answers. So just a quick quote from Paracelsus, poison isn't everything and no thing is without poison. The dosage makes it either a poison or a remedy. So he was a Swiss alchemist and physician. And in other words, what he was saying is that the amount of a substance an individual takes can have healing properties when used correctly or used with the correct amount. An example could be when you were taking Advil. So Advil can be good if you use it correctly, but it can also be bad or lethal if you use too much of it. So just a quick breakdown of calls that the Poison Control Center receives nationally. So this is all the calls for each state's Poison Control Center. In the year 2020, nationally, the Poison Control Centers received about 2.1 million calls regarding humans. We do receive calls for animals sometimes, but we usually just pass those on to the animal number. But for humans, 64% were exposure cases or cases where an individual consumed a substance accidentally or purposefully. About 34% of these remaining calls were actually information calls. So these are calls where someone just calls in regarding, wanting to identify a medication or identify a plant or, berry that they might see outside. So about 69% of these exposures were observed at home. That just means that, we were able to take care of it at home and they didn't need to go to the ER. And the remaining 2% of calls, which are included on the screen, those were animal exposures or confirmed non-exposures. And just on average, poison control centers receive a call for an exposure about every 15 seconds. So national poison data. According to the National Poison Control Centers, poisoning is the #1 cause of injury death in the United States. Every year, nearly 2.5 million poison exposures are reported, and 77% of these reported poisonings are unintentional or accidental. So here we're going to do a poll. And before you put in your answers in the chat box, wait, you can just put in the chat, but don't press enter yet. I'll give you 10 seconds and then we'll all press enter at the same time. So poll, who visits the emergency department the most due to drug poisonings? Sorry, you'll see the poll on your screen. Is it either children, teens, or adults? Okay, we've got a good amount of answers in. All right, so most people said that it is children, so people aged 0 to 12 years old are the ones visiting the emergency department the most due to drug poisonings. The answer is actually C, adults, and we'll see why in the next few slides. So for Massachusetts, and this is from the Massachusetts Department of Health, this is where we got the data. Residents aged 30 to 39 actually have the highest fatality rate for drug poisonings. This is about 2 times higher the rate than all ages. Residents who are in their 30s, so age 30 to 39, have the highest rate of hospital stays. So, going to the hospital and being admitted and staying there is what we consider a hospital stay. And residents ages 30 to 39 also have the highest rate of ED visits. So, just going to their emergency room and seeing an emergency room physician. So our highest rates from 2020 came from people in their 30s. When we're talking about counties of residence in Massachusetts, Berkshire County has the highest fatality rate. In the state, Hampden County has the highest rate of hospital stays. And Hampden County also has the highest rate of ED visits. And one more slide concerning Massachusetts. When we're talking about race and ethnicity, Native American, Alaskan, non-Hispanic residents have the highest fatality rate, about 2.5 times the rate of white non-Hispanic residents in Massachusetts. Black, non-Hispanic, and Native American, Alaskan, non-Hispanic residents have the highest rate of hospital stays in Massachusetts. And lastly, Black, non-Hispanic residents have the highest rate of ED visits. So regarding the Poison Control Center, in general, I don't know if I mentioned this yet, but our Poison Control Center actually receives calls from both Massachusetts and Rhode Island. But most of our calls are from Massachusetts. So for the burden of poisoning in 2021, this is from our last annual report, the Poison Control Center responded to about 33,000 exposure calls. 93.8% of our exposures occurred at home, and 68.3% of our exposures are managed at a home or non-healthcare facility. So to just go over the terms that I just used, a caller site is a location from where people are calling, and an exposure site is where people are exposed to the poison. So these two sites can be the same or they can be different. So, for example, a child may unintentionally take 2 doses of their medication at home before going to school. But once they get to school, the school nurse calls the poison center asking us for advice. In this circumstance, the caller site is the school and the exposure site is the residence. So for Massachusetts specifically, oh, well, we already went over that, but so about another thing that we see here is that about 83% of the exposures were unintentional and 69% were treated at the site of exposure. And that just means that, like we discussed earlier, they didn't need to go to the hospital or go to urgent care or anything like that. They could just take care of it wherever they were at. That's a pretty good number. So poisoning calls received by, and when you see PCC, that just means Poison Control Center, received by the Poison Control Center in Massachusetts, and this is by age. So as you can see from the pie chart, in Massachusetts for the year 2021, a majority of the exposures, about 55% occurred in children or pediatric patients, so age 19 and younger, under the age of 19, and 43% occurred in individuals 20 and older. And the missing 2% that you don't see in the pie chart are just people we weren't able to collect the age, maybe due to the call dropping or things like that, or the operator just didn't have time to collect it. So another poll question. So please let us know, what substance do you think is the top exposure for children 5 years of age and younger? And you can just put this in using the poll, and then I'll share their answers in 20 seconds. Okay, it looks like we got to a good amount of answers. So this is a related question, but a little bit different than what we're seeing on the screen. So which item is the most dangerous for a toddler to eat or drink? We have calamine lotion, household bleach, and arthritis pain relief cream. And we have about 82% say household bleach, and we'll get to that answer in 1 second. Okay, so something to keep in mind is that children learn through their senses: touching, sniffing, putting things in their mouth, and sometimes eating or drinking something they shouldn't. Due to their curiosity, the everyday items in homes, such as cleaners and medicines, can be very poisonous to kids. Medication dosing mistakes and unsupervised ingestions are common ways that children are poisoned unintentionally. As a result of the 39%, as a result, 39% of poison exposures for children, so ages 5 years and younger, in Massachusetts, were unintentional. 99% were unintentional. My apologies. And we're going to get to the answer for our poll question earlier in just a second. So cosmetics and personal care products. For the year 2021, cosmetics and other personal care products were the top exposure category for individuals 5 years of age and younger. Products such as hand sanitizers, toothpaste, creams, lotions, makeup, perfumes, those types of things that you use daily were some other reasonings for unintentional poisons for kids. Calls vary from children drinking hand sanitizers. I know a lot of people put that in our poll earlier, to having, or, licking their hands after using lotion and creams, or accidentally eating toothpaste. And just for a quick example, in one instance, a mother called our poison control center because her 2-year-old ingested some perfume. The child was sleepy, but the mother was not sure if it was in relation to the daughter drinking the perfume or staying up late. She wasn't sure of the alcohol content of the perfume, so she gave us a call about 20 minutes after the ingestion took place. We were able to find the product's alcohol content and calculate how much alcohol the daughter may have swallowed. Luckily, the amount was very small, and we advised the mother to let her daughter sleep, and if there were any changes of concern, to give us a call back. The next day, we followed up with the mom to ensure that her kid was doing okay and returned to her normal disposition and energetic state. And then we were able to close the case. Something to also note is that from bottles being left within reach or children licking their hands during, the COVID pandemic, a lot of hand sanitizer cases have increased for us. So Massachusetts poison exposures for children 5 years of age and younger. On this side, we have pharmaceuticals. On the other side, we have non-pharmaceuticals, like makeup, things like that. Children often believe that a poison is something that smells and or looks bad, and we know this is not always true. So due to this, when teaching young children about poison safety, we use the term pretty poisons. These are a type of poison that seems harmless and looks and smells good. If you refer back to the perfume story we just talked about, you can see how a 2-year-old may get confused and think, because the perfume looks pretty, that, it's okay to drink. So in other cases, we see it when we give caregivers. You may see it from like laundry detergent or like Tide Pods, things like that, because, they look like candy and they look fun. So also household cleaning products like bleach have been on the rise, due to the pandemic. And, a lot of people having bleach or sanitizer just lying around so they can clean up quickly. Another common call that we get are foreign bodies or toys, or, just small products like glow sticks and silica gel packets that you might find in like shoes and new toys and things like that, or clothes. For pesticides or things like that, this includes like, rat poison or things to get rid of like roaches, ants, things like that. This can also be confusing to children because it might look like candy and might be hanging around the kitchen or the living room. But thankfully, there are steps that we can take to help prevent these poison mishaps. And we're going to dive into ways that you can stop these from happening or educate the people that you work with. So child poisonings, but focusing on medication for children 5 years of age and younger. So in 2017, a child needed to go to the emergency room about every 10 minutes. This translated to 52,000 children 5 years of younger needing to go to the emergency room. This can be due to children getting into medication that is, left within reach, like on the counter in the bathrooms where they can reach it. And a recent study also showed that grandparents and older adults are more likely than parents to keep prescription medication in easy access places. Additionally, the study showed that about 80% of caregivers have made dosing errors. Ways to reduce the risk of dosing errors to avoid using teaspoons or tablespoons, as they come in different shapes and sizes and can hold the wrong amount of medicine. So, a good rule of thumb is just to use the dosing cup that comes with your medication. And one thing I really want to emphasize is to always encourage the people that you serve to read the drug fact label for all medications that they're using, no matter, how many times they've used it or how many times they've bought it in the past, just to make sure, nothing's changed. And here's a quick chart. So before 2011, infant Tylenol was 3 times stronger than children's Tylenol. The rationale behind this was that sometimes it's harder for babies or infants to swallow medication, so they just want to make it easier on the parents so they wouldn't have to give it as many times. This way, if the concentration of the medicine was stronger and given at a lower dose, it would give caregivers an easier time administering the meds. But a lot of times parents got confused and accidentally overdosed the child on the medication, causing issues like liver failure. Since then, infant Tylenol has been the higher concentration of infant Tylenol that they were using back in 2011 has been pulled from the shelf to avoid any confusion and unintentional overdoses. And Tylenol has also provided a chart that you guys can see right here to help provide caregivers and the people that you serve with instructional dosing sizes. I urge you guys to speak with the families that you visit and have them consult with their healthcare provider to get the correct dosing size to avoid any of those problems that we mentioned earlier. I'll give you guys a second to just look at this chart. So, medication protective behaviors. Some preventative medication strategies to pass along to the families that you serve are keeping medications up and away and out of a child's sight and reach. So we'll say that a lot. So up and away, out of sight and away. There's just good phrases to remember. To consider purchasing a lockbox for extra safety, to put your meds in and things like that, make it harder for anyone to access it. And a lot of towns and cities also offer lock boxes for free upon request. So you can have your caregivers reach out to their local health departments and see if they can get a free lockbox, which would be super helpful. It's always good to remind your families that you serve to review their medications with a medical professional, that they should never use more medication that is prescribed or, give the children that they help more medication than they need or they're supposed to have. Never to use medication that is prescribed to another person. So just because it's prescribed to one of their children or one of the people they work with, they shouldn't give it to someone else in the house because it may not necessarily work for that other person. To always compare active ingredients of products to ensure the child is getting the correct dose and nothing is interacting with one another. It's always good to try to avoid storing medication in bathrooms used for bathing or showering. The dampness can cause the medication to deteriorate. Always a good rule of thumb to never, take your medications in the dark. Might be late at night, you forgot to take it and go back down, but you don't feel like turning on the light. That can cause issues because you might take someone else's meds because you can't see very well or take the wrong med. So just make sure, you turn on the light. And make sure to always properly dispose of expired or unused medication. Maybe every 6 months, just recommend that they go through their medicine cabinet and throw away anything that shouldn't be in there or that has expired. Another way, it's always good to remember the community take back days. These occur twice a year, like in April and October. When it's closer to these months, they can call their local police departments and pharmacies for more information. A lot of times these will also be advertised on social media. There's also drop-off boxes located at hospitals and pharmacies. And families can also do an in-home disposal. When doing this, though, adults are going to want to mix the medicines with something that people and pets are unlikely to try to eat, such as litter or coffee grounds, and then place this mixture in a sealed plastic bag and dispose of it in the trash. We can get more information on all these things from the FDA. So dietary and herbal supplements. So one thing to remember is to remind the people you serve to take caution with dietary and herbal supplements. There have been 1,500 documented interactions between drugs, herbal medicines, dietary supplements. Just because a product claims to be natural doesn't necessarily mean it is safe. And just because a product claims to be all natural does not mean that it is free of hidden drug ingredients, have hidden metals or other substances that can be helpful or harmful to your health or your child's. This center receives a lot of calls in regard to children ingesting melatonin gummies and becoming very sleepy. So if you don't know, a lot of people give melatonin to their children or to themselves so they can sleep better. Though melatonin is low risk, it should never be given to children under the age of 3. And this is for all dietary and herbal supplements. They should always be kept out of a child's sight and reach. So we have a quick quiz coming up and we'll have a poll show up. Which item is the most dangerous for a toddler to eat or drink? Calamine, lotion, household bleach, and arthritis pain relief cream. And we already did this one earlier. I don't think I can bring. Oh, there you go. So hopefully you guys can see the answers that everyone put in. So the answer is arthritis pain relief cream. About 13% of people got that correct. And we'll just go over why that is because that can be kind of confusing. So the correct answer is arthritis pain relief cream. This is something to consider when working with grandparents raising grandchildren or where an older adult has an active role in childcare. Though bleach is very dilute and can cause vomiting, and calamine lotion is essentially non-toxic, anything taken at a high dose enough can send a child or adult to the emergency room. So here we have something, we're going to pick the poison, and don't put in your answer just yet. So when I say go, you can put your answer in the chat. The images above display one of two substances. One is a child's multivitamin, so like a Flintstone gummy. Oh, sorry. One is a Flintstone gummy, and the other one is kind of, the other one's just regular gummy bears with, no medications, no vitamins. Using the poll in a second, just put in your answer and let us know which one you think is the regular like candy gummy bear, not the vitamin. And don't put your answer just yet. And again, I'll say the question. So which one do you think is the regular gummy bear? Okay, I see a lot of people putting their answers. Looks like we got a lot of B's. This one's definitely very confusing because I think they look the same. Looks like most people said B, and B is the correct answer. So B is the regular gummy bear, and A is the gummy vitamin. So as you can see, they look pretty similar. So that would easily be confusing for a child, and that's just why it's a good idea to keep the medicines and the vitamins locked up. But good job for everyone for putting your answers in the chat. We'll keep going. So looking at the image on the screen, you can see that medications and candy seem to have a similar appearance. And as you can tell from the previous exercise, as an adult, we may even have trouble distinguishing the differences. So a child's definitely going to have confusion when it comes down to it. Yeah, and I see Sue is saying she really couldn't tell. I also still can't tell, and I've seen that slide multiple times. But here's some other ones that look similar. So, you have Skittles, and you have the medication. You have aspirin here, but then you also have Altoids, M&Ms, and decongestant. So, a lot of these just look similar. So that's why it's always important to tell the families you serve to make sure they lock up their medicines. So medication safety, risk factors, and protective factors. It's also important that caregivers never refer to medication as candy. As you can see from the previous slide, it can be hard for a child to tell the difference between substances. Be sure to tell caregivers to keep medications in their child-resistant packaging and avoid putting medications or over-the-counter meds or prescriptions in a Ziploc bag or container that can be easily opened by a child. And make sure that they keep all medications and vitamins up and away and out of sight and out of reach. And to always remember to tell kids that they need to ask an adult before eating or drinking something that they're unsure of. So we have another one. So wait 10 seconds before you put your answer. I'll say go. And just for a second, think about which one you think here is not the poison. So one of these is spick and span cleaner, and one of these is grape juice. So I'll count to 10 and you can tell me which one you think is grape juice. Okay, go ahead, put your answers in the chat of whether A or B is grape juice. Okay, I'm seeing a lot of people saying B is the grape juice. Okay, awesome. So it looks like most people got that one correct. I'm not sure how everyone's knowing. But yeah, so A is the spick and span cleaner and B is grape juice. They do look similar, but I guess you could say the grape juice is a little darker. Yeah, and I guess the cleaner is a little bit more translucent, but this would definitely be hard for a child to tell the difference, especially a lot of times because the cleaners, have scents to them. But there you go. Let's do another one, or we'll go over some more factors, protective factors. So cleaning product protective factors. So as we talked about, cleaning products can resemble things that we drink. So make sure to always inform caregivers to leave all products in their original containers to avoid confusion for anyone, for kids or themselves, and to never mix cleaning products to get a stronger effect, because a lot of times this can also create harmful gases. So for example, if you mix bleach and ammonia, chloramine gas is generated, and that can cause a lot of coughing. And I'm sure you guys have maybe heard of that before. And also mixing bleach with acidic cleaners can cause chlorine gas to be released, which isn't good. So if caregivers are also using cleaning products, make sure that they just open the windows so air can circulate, throughout their home or apartment. And lastly, that applying child locks to cabinets is super important. So you should do that in your kitchens and your bathrooms or your pantry, wherever you put your cleaning products. But it's always good to remember that nothing is child-proof, only child-resistant. So at the end of the day, nothing substitutes just adult supervision. Carbon monoxide safety. So the phrase silent but deadly should come to mind when you were talking about carbon monoxide. It is a colorless and odorless gas that is produced when ordinary fuels burn. So we're talking about gasoline, kerosene, wood, propane, and natural gas. Some preventative strategies to inform the people you serve include the following. So having the furnace and heating system inspected and serviced annually, never using grills or hibachis inside your home, never operate gas burning appliances in a closed space. It's always a good idea to make sure you have installed carbon monoxide detectors throughout your home, especially near sleeping areas, because carbon monoxide, you can't smell it. And to check or replace the battery when you change the clocks each spring or fall. So, when you fall back or, spring forward, just check, your smoke detectors and things like that. And then replacing your detectors every 5 years. And Massachusetts has actually partnered with the Red Cross for a campaign called the Massachusetts Home Fire Campaign. And they will go and install 3 free smoke alarms for those in need. And they'll also test existing alarms to make sure they are working correctly. And I'll give you guys a link for this home fire campaign at the end of the presentation. And I know it's warm right now, but when the snow comes back and, winter's coming back and we're worried about snowstorms, good thing to remember is nothing should be blocking your car's muffler. And to always keep your generators at least 20 feet from the home, and make sure that the engine exhaust is directed away from any windows or doors. So lead exposure. So homes built before 1978 may contain lead. Lead laws in Massachusetts are set to protect a child's right to lead safe home. Some symptoms of lead poisoning can be very vague. So, stomach pain, fussiness, not being able to concentrate, not feeling hungry, so loss of appetite. But a lot of these things can be confusing because a lot of other sicknesses cause these same symptoms, not only lead poisoning. Um, so there are treatments for lead poisoning, and but there's no substitute for prevention. Um, so families and caregivers can also call their local health department or CLPPP, and they'll let them get a free poison blood test. And then, some other reminders are, try not to purchase inexpensive metal jewelry for children. A lot of these, like jewelries and toys, have been recalled because they contain lead. And also, another good thing is to remember to prevent children from licking or sucking on little materials like hobby materials that could contain lead. These are things like bullets, pellets, fishing materials like fishing sinkers, things like that. Just a quick story. So, a lot of times, a study found that children in communities with the most gun licenses are more than twice as likely to have elevated blood levels compared to children with less gun licenses present. A lot of times, this could be present because a lot of guns use lead-based primers for their bullets. And this could inadvertently expose kids to lead dust. So it's just recommended that if you do have a gun in their home or one of the caregivers does, and they're cleaning the gun, to make sure that the environment is controlled, and that after they're handling the gun, before, interacting with any of the kids or any other people in the house, that they shower and change their clothes to make sure the children aren't exposed to lead. And then lastly, for financial assistance when it comes to lead. So de-leading your home can be very expensive, but it's good to remind the people that you serve that Massachusetts offers programs to provide financial help, such as tax credits, and also a program called the Get the Lead Out, which provides cost financing, and they also provide some loans. And I will go over some of the resources that we have. So here are some resources to go over the lead laws, finding and removing lead in your home, the financial assistance that you can get from Massachusetts, and then child lead poisoning prevention program. This will be included in the slides that we send out. So what can you do to prevent poisonings from happening? So preventing poisonings is not just about getting the toxic substances out of the house, because that's impossible. It's about taking precautions when it comes to using, storing, and disposing of household substances. And before we get into all of that, we're just going to take a quick break. I'm sure you guys are getting antsy. We'll take a 5-minute break and come back and finish up all of our poisoning tips. So we'll come back at 10:52. And I'm seeing the questions in the chat. Looks like you got an answer. But also, if you want to talk about it more, we'll have a poison specialist on here in a few minutes at the end, and he'll be able to give you a better answer on that too, better than the one I was going to give you. So we're going to do a quick activity in breakout groups. We're going to split up for about 10 minutes, and I'm going to have you find the poison. So everyone will be assigned to a room in a house. You're just going to talk within your groups, either on chat or through the microphone, and talk about what poisons you think would be present in the rooms. So Alexandria, I'm going to let you go ahead and split everybody up.
Sure. Before we do go into breakout groups, we're going to be using Jamboard. Some people have been in previous trainings and may have used Jamboard before, others may not. So I'm just going to quickly give a brief overview of how to use Jamboard for when you're in your breakout rooms. So when Emily puts you into breakout rooms, the top of the window will tell you which breakout room you will be in. So from there, you will be able to, just about to share my screen. From there, the slides on the Jamboard will, so the slides on the Jamboard will tell you which room you will be going into. So for example, the top right will have, the top left, I'm sorry, will have room 9. So if you're in breakout room 9, which will be again at that top left, you'll head to breakout room 9, see what poison hazards and prevention strategies you could put into place from what you've learned so far into each of these rooms. If you want to take notes on the slides themselves, you can click sticky note and you're able to type in anything you want to. And then there's also this chat box function as well, where you can do a bulleted list of protective factors and risk factors if you would like. All right, that should be it. We'll be able, Fota, Emily, and I will be popping in and out of the breakout groups to see how you're doing. So you will have that 7 to 10 minutes to kind of go through and work with your group. It is recommended that you elect someone to type the notes. When we come back, you can have that person share some protective and risk factors that you found. All right, so we'll have 7 minutes in those breakout rooms with your groups. And if you have any questions or concerns, please let us know.
Sounds good. Let me just close this. Okay, everyone can see the screen. Okay, perfect. All right, so I was able to pop into some of the rooms. You guys seem like you're doing a great job. Hopefully you guys were able to get a lot of discussion in there too. So I'll just quickly go over some answers because I know we're closing in on time, and I want you guys to be able to do the Q&A at the end too with Jeff. So keep going. All right, so here are just some of the answers that we were thinking of. But also if you want, you can put in the chat what room you had and then some poisons you thought of. You can just take a look and see what poisons are probably in those rooms that you were assigned to. I'll just leave this up. So we have kitchen, you can have oven cleaner, ammonia, laundry room, Tide Pods, disinfectants, softeners, things like that. The living room, maybe cigarettes or, alcoholic beverages, plants. I know someone in the bedroom group said plants, and that was a really good one. Bedroom, you can have cosmetics. A lot of people are saying makeups and lotion. In the workshop, you have, pesticides, maybe gasoline. Garage, you have antifreeze. And can everyone hear me?
Yeah.
Yes.
Yes.
Yes. Yes.
Okay, perfect. Thank you. In the bathroom, you might have mouthwash or medicines, things like that. So in the groups I was able to go into, you guys are doing great. So good job on that. All right, so let's get into marijuana, and we're just going to do a quick overview of the rest of these slides. So marijuana refers to dried leaves, flowers, stems, and seeds from cannabis or indica. So just a quick history of marijuana in Massachusetts. In 2008, Massachusetts passed a sensible marijuana policy initiative, and this is just decriminalization for possession of less than 1 ounce of marijuana, which is now just punishable by a fine of $100. In 2016, it was legalized recreationally, and then in 2018, the first dispensaries opened for recreational marijuana, but there are still regulations. I'm sure, as you guys know, there are different types of products. for marijuana. You have dried marijuana, edibles, beverages, all types of things. Some just quick notes on it are that smoking gets you high faster, whereas edibles can take longer to kick in, but they can be much stronger. The most common marijuana exposure among children are usually from edibles, and we'll go through that in a second. So here's some data from Massachusetts marijuana exposures, and this is from the Poison Control Center. So the numbers that you guys see on the screen are the number of calls that we received about marijuana. And as you guys can see, it kept trending up as time went on. It did go down a little bit at the end of 2021 for unknown reasons. Just important to remember that this is Poison Control Center data, so this just shows us the number of calls we got, and it does not necessarily reflect all of the THC exposures in the state, including hospitalizations, any ER visits. Usually the state keeps count of all of that information. So types of edibles, there are lots of different marijuana edible types. So you have candies like lollipops, hard candies. You have gummies or gummy bears. You have baked goods, so, brownies, cookies, bread, Rice Krispie treats. You got beverages, you got oils. So there's just a lot of different things that can include marijuana in them. So when you think marijuana, you shouldn't always just think, smoking. So we're going to do another one of these in the chat. You can let us know which one do you think is the gummy candy, just regular candy you can get at CVS, and then which one do you think is marijuana candy? So take a second, think about it, put your answer in the chat. So yes, which one do you think is regular candy? All right, lovely job. Looks like everyone got it right. So A is the regular candy. That's just your regular, I think, Sour Patch Kids. And then B is the marijuana candy. But as we've been going through this entire morning, a lot of these look similar. So this would definitely confuse, maybe an older adult or a child or someone who just doesn't know the difference. So here are some lookalikes. So you have the regular food or product, and then next to it has something that includes marijuana or THC in it. So as you guys can see, this could definitely be confusing to a lot of people if they did not know the difference. So it's always important you tell the families that you serve or caregivers to make sure that they separate any marijuana products they may have in their house with the regular products, because child would definitely get confused with these Sour Patch Kids or these Doritos or these Cheeto Puffs and think that they're regular food when, it's not. And, you can always, when you're, maybe dropping off your kids with like a babysitter or things like that, you can always ask them to, put these products away or things like that. So in case of an exposure due to marijuana, there are some short-term effects and some long-term effects that can be included. So short-term could be altered sense of time, maybe hallucinations or delusions, impaired body movement and memory, paranoia, anxiety, or maybe more physical symptoms like vomiting, things like that. Long-term effects include lower IQ, more likely to drop out from school, things like that. And then in case of an exposure to marijuana, someone who's not supposed to be in it, make sure that you call 911, or you can call the PCC if it's not, an immediate emergency, or you can bring the child to the emergency room if it's close enough for you. And make sure caregivers are honest and open if there are marijuana products in their home. So if a child is lethargic or, acting different than they normally do, and caregivers do not mention marijuana, the child is most likely going to have to go through lots of tests. They can be rigorous, invasive, painful, like a spinal tap, so the doctors can figure out the diagnosis if, the caregiver didn't say that, hey, it might have been marijuana. So just make sure that they're always honest with what's in their home. And I'm seeing Sheeta, I'm seeing your answers. Good answers, yeah. Protective factors for marijuana. Make sure all products are labeled and make sure marijuana is kept up and away and out of sight of reach of children. It's always good to remind the people that you serve that nothing is childproof, only child resistant. And if you have the marijuana products in your home, make sure that, the children are being supervised. So especially, if they're in the kitchen or in the bedroom, wherever the marijuana is located, just make sure they're being supervised. It's always a good idea to put marijuana products away after every single use. So don't leave it out on the counter and leave it out on your dresser, because that's easy access for a child. Make sure all the products are labeled, kept in their original containers and out of sight and out of reach. So maybe putting it, in a high cabinet locked away, or putting it in putting the marijuana in a lockbox. And like we just discussed, if caregivers are bringing their child to another home, just always ask, is there marijuana in the house? Is there marijuana here that I need to know about? And then you can also share they can also share these tips. Okay. We're going to take a 3-minute break. So we'll come back at 11:17. Just use the restroom, things like that. And then we're going to try to finish up these slides for you guys. Break, and we're a little bit more than halfway through. You guys are doing great. So we'll continue on. So the great outdoors. So we'll be talking about bites and stings, repellents, pesticides, things of that sort. Insect bites and stings. So as we are in the warmer months, here are some tips to pass along to the families that you serve. So ticks. Lyme disease is an infection caused by tick bites. Infected ticks are carried by deer and other outdoor animals. Lyme disease usually causes a rash around the bite, and some symptoms that everyone wants to watch out for include chills, fever, headache, fatigue, and joint pain. And Lyme disease can be treated with antibiotics, but if a person has a tick bite and then is not experiencing symptoms, generally antibiotics are not recommended. And some areas you want to watch out for to avoid ticks are moist, woody, leafy areas. So humans and pets come into contact with ticks when they hike, camp, play, or work in these types of wet, woody areas. And ticks can also attach to larger animals, especially deer. And the best treatment for ticks is prevention, and we're going to go over these in a second. Now that we're in summer, you also want to watch out for bees and wasps and yellow jackets, hornets. So stings from these insects are very common and also extremely painful. A lot of people call the Poison Control Center after a sting in regards to how to treat or remove the stinger, but more importantly, because a lot of times people are worried about an allergic reaction, which is understandable. So pain, swelling, and itching at the site of the bite are common. And an allergic reaction can also involve, trouble breathing, chest tightness, swelling, and things like that. It's always important to remember and to pass on to your families that allergic reactions are medical emergencies and you should call 911 right away. So mosquitoes. The majority of mosquito bites only cause minor skin irritation. However, mosquitoes can also spread serious viral, bacterial, and parasitic infections such as West Nile virus and triple E. These two are the most present viruses from mosquitoes in Massachusetts. If someone's bitten by a mosquito, they should wash the area with soap and water. and watch the site for signs of infection. And the signs may include, pain, swelling, redness, or warmth, or just oozing of fluid. If this occurs where, they think they might have been bitten by a mosquito, you should seek immediate medical evaluation and treatment. So repellents, your bug sprays, things like that. So DEET is an insect repellent sold widely in different concentrations. Can be in a lotion, a spray, wipes, and you can just use them on your skin. While it is effective at small concentrations, higher concentrations do offer better protection for a longer period of time. DEET should only be applied to exposed skin only. So if you do need to spray it to your face, just make sure you spray it on your hands and then rub your face. Don't spray it directly on your face, or tell your families not to spray directly on their face or their children's faces. Children's eyes, mouth, and hands should always be avoided because you want to spray on their hands and then they go touch their nose or eyes. If repellents do get in the eyes, just make sure you rinse the eyes for 15 minutes and then call us at the Poison Control Center. Always good to know that DEET should not be used on infants 2 months of age and younger. For them, you can use the repeller fans and the nets. You can get a lot of these from Amazon. When coming back from outside, make sure that the families you serve, that once they come back inside, they shower and wash their hands with soap and water and remove any of the clothes that they were using outside. The CDC does not know the effectiveness of natural repellents since they're not on the EPA registered insect repellent list. To protect yourself from mosquitoes and ticks, it's recommended that you use one of the above repellents listed, or your families can also go to the cdc.gov website, and we'll have that link in the slideshow when we share it with you guys. So just more safety, kind of repeat of what we just talked about, but avoid areas that likely harbor ticks. So, overgrown areas, brush, leaf litter. If you are walking in the woods, stick to the center of the trail. Use insect repellent containing at least 20% DEET to repel any mosquitoes, and make sure you spray it on any exposed skin. And if you have children with you, the adults should spray it on the kids, not the children do it themselves. Just shower once you come back from being outdoors. So you can wash off any ticks, and then, look at your clothes and make sure there aren't any ticks on your clothes or anything like that. And, throughout the summer, just check the children, the pets for ticks and make sure they're not bringing any in the house. Good places to check are the armpits, groin, behind the ears, the scalp. Finding and removing ticks quickly can help prevent infections later on. And if you do find a tick, make sure that the families that you work with know that they should remove it with tweezers. Grab the tick head directly and then just pull it out, and that they should clean the area very well. They should not be using, a lot of these home remedies that we know, like hot matches, petroleum jelly, or other things that they know of. And for bees, make sure you're just not scratching the bite. Avoid scratching the sting. Yep. And then for mosquitoes, use your repellents. Wear clothing that covers you up if you're going to be outdoors hiking or walking, and try to limit time outdoors when mosquitoes are most active. This is usually between dusk and dawn. And then for littler kids or smaller kids, use mosquito netting to cover their infant carriers. So pesticides and rodenticides. So rodenticides kill mice, rats, and other rodents, but they can also just be super harmful to humans and pets. They can cause bleeding if they are eaten. For kind of what we talked about earlier, a child may see, rat bait or things like that and think it's candy. So it's just important that, you keep it out of sight for the kids, or you let them know that this is really bad and you should not be playing with it. Yep. And to keep rodents out of homes, just important to tell the families that you serve to keep trash covered, make it hard for rodents to enter the home. So plug up all the gaps, the windows, things like that, doors, any holes that they might find. Um, and if possible, they should try to use traps instead of poisons. Okay. So Massachusetts and Rhode Island, before we go into our next scenario, we're going to do one last practice scenario. I just also want to quickly go over the Poison Control Center and our background and what we do and how we can help if any of the families that you work with needed to call. So the Poison Control Center is a nonprofit organization that provides assistance and expertise for diagnosis, management, and prevention of poisonings throughout Massachusetts and Rhode Island. We are a part of the AAPCC, or the American Association of Poison Control Centers, which is a national voluntary health organization that represents the nation's 55 poison centers. We were established in 1955 at Boston Children's Hospital, but we do serve people of all ages. Our office is just located at the Children's Hospital, but adults, the elderly, children, anyone can call and receive help from us. And as of today, we serve a population of over 7 million people. So we do provide two main services. The Poison Help Hotline, which is likely what most of you guys know us for. And then we also provide comprehensive education for both healthcare professionals, such as you guys, or the general public. So we can do presentations, such as this one. We do this, for different groups, for, new parents or nurses, things like that. And then we also have our Poison Help Hotline where people call for emergencies or questions. So the Poison Help Hotline is operational 24/7. It is a phone service that provides medical advice to callers who have experience of poison exposure or who have a question about poisoning or potential poisoning. Just important to let the families that you serve know that the service is free and it operates 24/7, 365 days a year. All calls are handled by spies or specialists in poison information. And these individuals are medical professionals such as nurses, pharmacists, doctors, toxicologists, meaning that all the information you get from them is coming from a reliable source. All of our calls are confidential, meaning that the information you share with us is kept private. That's another important point to drive home to the families that you work with, because I know that can be a fear for some people. And in the case that the families that you work with do not speak English, we also have an interpreter service in 150 different languages. So how does the PCC do it? How does the Poison Control Center do it? We provide information on over 500,000 potentially toxic products. And we provide info on drug interactions and reactions. We analyze statistics, noting poison trends locally and nationally. So those are some of the numbers that we looked at in the beginning of today. And we work in coordination with the Department of Public Health and the AAPCC. Specifically, some of the current trends being analyzed by our center are focused on marijuana due to the legalization of marijuana. We've had a lot of requests come in for data from different organizations about this. And a lot of our data extraction focuses on vaping and COVID-19, and different unintentional pediatric ingestions for different products. Additionally, the Poison Center also helps manage medication, side effects, substance abuse, malicious poisonings, and suicide attempts. So if you had to guess, what do you think the national average cost for an emergency room visit is? Go ahead and you can put this answer in the chat. So how much do you think it costs to visit the emergency room? Okay, getting a lot of good answers. Jasmine said 1,000. Mary said 250. Tatia said 5,000. Jenna said 500 to 2,500. It's a good range. Okay, getting a lot of good answers. 3,000 from Carmen. So the answer is the national average bill for a visit to the emergency room is anywhere between 1,200 to 2,200. So we got a lot of answers. May was around there. Due to the fact that about 70% of calls to the Poison Center can be treated at the site of exposure. So that just means that about most of our calls, they can be treated at home. So you wouldn't have to go to the emergency room. So our services help prevent costly hospital charges and prevent an unnecessary visit to the emergency room, which is always good. A recent study showed for every $1 invested in poison services, $13 is saved in healthcare costs. So just another reason why you guys should encourage the families that you work with to call us. And P. Anderson, I'm not sure if that number is without any additional test, but I can get an answer for you on that. So when should people call us? So if there's been a poisoning, if they're concerned about a possible poisoning, so they're not sure, to ask just a prevention question. So they don't always have to call us if, it's a serious emergency. If they just have a regular question about a potential poison, they can call us. And you guys can also contact us to ask for poisoning prevention materials. And I'll show you how to order the free materials from us. This includes like brochures, stickers, magnets, magnifiers, so they can read medication labels, things like that. So what should people do if a poisoning occurs? So if someone stops breathing, collapses, or has a seizure, call 911. And I'll just say that again. So if it's like an emergency where someone's not breathing, they faint or collapse or have a seizure, don't call the Poison Control Center. Just they should react normally as they normally would and just go straight ahead to 911. If one of those three things does not happen, they can call our hotline. And when someone calls to speak with our hotline service, they should be ready to provide information on the patient's age and weight, where they could have been poisoned, and the amount of poison that they may have ingested or been exposed to, and also when the exposure took place. It's always important to remind families to remain on the phone with the Poison Center until the call is finished. And again, when not to call us, just important to reiterate, if someone stops breathing, collapses or faints or has a seizure, directly call 911 because this is an emergency that requires immediate attention. Okay. So we're going to do a scenario, but we're running a little low in time, so we're going to do this together and we'll just use the chat. And this is just a way for us to practice what we've learned today. So I'll read this out for you guys and I'll give you a minute to just read it again to yourself. So we have 7-year-old Chade is playing with her friends at school. The teacher isn't paying attention, so Chade and her friends go into the supply closet. They start smelling all of the blue bottles within the supply closet. Chade even sneaks in a sip of one of the blue liquids. Once she gets home, her mom quickly realizes that Chade is not her usual energetic self. She is very lethargic and keeps complaining of dizziness. Her mom looks in her mouth and sees that her tongue is blue. I'll give you guys a minute to just read that again. Okay. So here's some questions. Oh, I see Carmen's answering. Good, good. So let's do the first question first, and you can just put your answers in the chat of what you're thinking. So what info should Sade's mom be prepared to answer when she calls the Poison Control Center? Okay, so we're getting a lot of answers. I do see a lot of people saying 911. I guess if the mom was very concerned, she could, but she didn't fall into one of the categories of, passing out or having a seizure or stop breathing. So she's still awake. She's just a little sleepy. Um, so she could still call the Poison Control Center for this one, but I do see where you guys are getting with that. So what info should Sade's mom be prepared to answer? So I'm getting a lot of good answers. Gail, so child's age, weight, symptoms. Weight, yeah, that's another good one to add. So hopefully I'm pronouncing this correctly, but saphonery was a name, age, location, symptoms, perfect. Yep, Natasha. Mary said when she notices symptoms, that's awesome too. Sandra saying she needs to know the chemical, perfect. So yeah, getting a lot of good answers. Yeah, these are all great. So name, age, when she thinks she may have drinking the liquid, what liquid it may be, if she knows. And then, symptoms that Sade is having. So perfect. And Tati is also saying she could talk to Sade, yeah, which is also good to get more of a background. Okay. Awesome, guys. Okay, glad I pronounced it correctly. Good. Exposure site. So this is, oh, Nancy. Okay, yeah, Nancy's getting a little ahead. Perfect. So exposure site. What do you guys think the exposure site is? We talked about this earlier in the slides. So what could be the exposure site for Sade? Awesome. So I'm getting a lot of people saying school. Yeah, so school is correct, more specifically, the classroom supply closet. So that would also be good information. If Sade can remember and provide that to her mom, that'd be good information for the Poison Control Center to know, because that helps us narrow down what she could have ingested. Perfect, great job, guys. Third question, what is an example of a protective factor in this scenario? So protective factors, as we went over, things that, limit the risk. And maybe, was there even a protective factor in this scenario? Okay, great. And yeah, Amy kind of got at to where I was going. So this one was kind of a trick question. So there really wasn't a protective factor, but this protective factor that could have been present was the supply closet being locked. Or yeah, like Sandra's saying, teaching the children not to drink the liquid since they didn't know what it was. So there were some protective factors that could have been implemented and they weren't. Yep, or like Gail saying out of reach, keeping everything out of reach. Yep, adult supervision. So all those could have been protective factors. And then lastly, what is an example of a risk factor in this scenario? So kind of what put Sade at risk for drinking that liquid? Nice, Gail. That's awesome. Yep, Margaret, good. Tatia, that's awesome. Ty Jones, yep, you guys are doing awesome. So lack of supervision, um, the liquids were within reach to the kids. They shouldn't have been. It was way too close for little children to be able to reach up and drink it. Um, Peer influence is an interesting one. I've never heard that, but yeah, I can see that. Um, but I guess that kind of goes back, into being unsupervised. Yeah, so great, guys. Here are the answers if you want to take another look at them. You guys did awesome with that. That was great. You can always share this scenario too with the families that you work with. And now we're getting into outreach. So another big thing that we do here in the office is we provide free materials. It's always free. Materials that you can pass out to the families that you work with. So we're talking about brochures, and they're in lots of different languages. Magnets to put on their fridges, stickers. A lot of people put them on their phones. One of the high schools that we work with, they give them out to the students. Magnifiers, maybe for adults or older adults when, a lot of the font on medications can be very small. So just magnifiers, so they can make sure that they're picking up the right meds from the cabinet. Yeah, we offer a lot of different materials, and all these are free. You would just email me or or fill out our website's order form, and then we'll get that packaged up and sent to you. We also do public events. So we do presentations such as these, and before COVID, we did like health fairs and things like that. And hopefully in the fall, we're going to go back out into the community and be able to do that. And here's our website. We are actually trying to update our website. You can still get lots of good info here, and games and printouts and things like that. So it's just maripoisoncenter.com. We also have a Twitter and a Facebook, and that one's more updated. I try to get some tweets out or some Facebook post out a couple times a week. So you can also get a lot of good info there. And I'll show our links to that in a second. Again, here's just some things you can find on our website. And as always, you guys can always just reach out to me. And I can do smaller presentations for groups that you work with. And just recently I did one for teen moms. And we can just cater it to the group that you work with. So after all that you've learned today, what are some things that you can do to prevent poisonings? You can throw that in the chat, some things that you can do to prevent poisonings from happening within your community. Educate, that's a good one, Natasha. Sharing the website, yep. So share the website, the Twitter, the Facebook, especially Twitter. I know a lot of people are on there now. Yep, tell people about the training. I like prevention plan, Ty, that's a good one. Yep, always share materials. I love sending out materials. We have so many, so you can always order more, and it's free. Sharing prevention strategies. Yep, those are all perfect. Great. Love it. So, yep, identify poison risks, prepare caregivers. So, just everything that you guys were saying, disseminating information, using our teaching tools, all of that. Okay, and we're closing in on the end of the slides here, but just some key messages I'm hoping everyone will take away are: poisoning affects people of all ages, so from infants to the elderly. Medication mistakes are the most likely poisonings to be fatal. Not all poisonings require emergency care. But if someone has passed out, they're having a seizure, stop breathing, then do call 911. Make your home safer by discarding old medicines, chemicals, and cleaning products. Keep cleaning products, chemicals, and medicines up, away, and out of the child's sight and reach. Never refer to medication as candy. Compare active ingredients with the medications that you take. Keep products in their original containers. Never mix cleaning products together. Teach children to always ask before eating, drinking, or smelling something. Nothing is childproof, only child resistant. And make sure all caregivers have our phone number, our poison help hotline in their phone. So, next time you see them, just share our poison help hotline number with them. And I have it in my phone too, just in case, because you never know when you'll need it. And lastly, needing the Poison Control Center is not a fail. Things happen unexpectedly. So if you need us, just give us a call. And again, I'll just leave this up for a second so you guys can get our Twitter and our Facebook. And if you don't remember this, just look up Massachusetts, Rhode Island Poison Center. I usually try to hashtag everything. So I'm going to leave this up for a minute. So go ahead, take out your phones and save this number if you don't have it already, so that you can give it to your clients next time you see them. So it's 1-800-222-1222. Okay. And here are all the resources that we talked about. So you got med safety, carbon monoxide, just our information right here, our poison center info, lead prevention, bug sprays, marijuana, some other hotlines for tobacco and nicotine, and also suicide prevention. And this will all be in the slides that we send out. Oh, sorry. Okay, thanks so much for listening, guys. I'm gonna switch over and let our C-Spy Jeff Pierre answer any questions. He's a certified poison specialist here at the Poison Center. So if you have any questions that you want to ask him or us, you can go ahead and put that in the chat or unmute if you can, or just put in the chat. And thank you guys for listening. And Jeff Pierre, are you there?
Yes. Hi.
Okay, perfect. So yeah, he's here if you guys just want to ask any questions.
Hi, I'm Jenna, and I have a question regarding marijuana.
Okay.
Should lengthy exposure to marijuana smoke be considered a poison exposure for infants?
A lengthy exposure to smoke.
Yeah, marijuana smoke.
Okay, so I think I would just ask further questions. How long were they exposed? Where they were exposed? I would actually check in with our toxicology team as well. And I probably would send them in to the emergency room.
Okay.
I probably would send them in for a lengthy exposure. But I would check in with my team because that's not something we get calls on often. Usually it's edible, like a marijuana edible, and that would be grounds for an emergency room referral right away.
So I'm asking this question because there's so much smoking going on.
Right.
And I'm not sure that parents always appreciate the impact of smoke on young children. And so I guess I'm wondering, what should be, if it's just a knee jerk, call 911
Yeah.
or take it to the emergency room, or if it's what symptoms should be looked for? How do we educate parents?
Sure. So I would definitely have them give us a call, and I
Uh-huh.
think it would be a case by case basis. But I would definitely look for signs and symptoms like drowsiness, problems breathing, any weakness if they're not acting appropriately. And if so, then I'd bring them in. But that would be, again, a case by case basis. And it's something I would have to discuss with my toxicology team.
Okay, thank you.
This is Becca Thomas. I work with Jeffrey and FOTA. I am the acting director of the Division of Violence and Injury Prevention in the Department of Public Health. So another thing that we really get concerned with that kind of consistent exposure to marijuana smoke of very young infants is sudden infant death syndrome. That just like tobacco smoke can influence the development of a fetus or an infant and increase their risk of sustaining sudden unexpected infant death. So too can marijuana smoke. So I think that's a really important thing when you're talking to the people you serve about safe sleep. And if you notice marijuana in the home, let them know that that is a risk factor for SUID. And some of the mitigation or harm reduction tactics that we recommend is smoking outside the house or away from wherever the infant is, taking a shower after having smoked to get the tertiary smoke off of the body, hair, and clothes, or if a shower is not possible, changing their clothes and really having that great ventilation in place. But I completely agree with everything that Jeffrey said and just wanted to add about the SUID component.
Hi, my name is Amy Grissett, and I wanted to share a situation having to do with cleaning products. My granddaughter, her aunt, about 5 years ago, newly married in her 20s, decided to clean her bathroom after her husband left for work, and he came home from work and found her deceased. And very tragic, but had no ventilation in the bathroom, was using multiple cleaning products, had no fan. So it was very, very tragic. And our family, unfortunately, our family learned from that, but such a sad situation. But these things are real, and you have to take precautions. I just wanted to share that.
Thank you for sharing.
Yeah, thank you. Sorry, Jeffrey, for jumping in, because there was a Buffalo Wild Wings case, I think a year or two ago, with this very similar case. They mixed a couple cleaning products together, had to evacuate the building. It resulted in one fatality and I think a couple of hospitalizations as well. So Amy, thank you for sharing that. You're absolutely right that just don't combine cleaning products, and ventilation is really important.
Agreed. I would also just say, particularly ammonia and bleach, that's one of the more common mixtures. And it can produce like a toxic gas, chloramine. So that particularly, among other mixtures, we recommend to avoid. And again, the ventilation is very important. And to reduce the exposure as much as possible, the time.
And I didn't find out what the products were that she had used, but I mean, her husband is still dealing with this loss, even this many years afterwards. So just think it's critically important to educate people around that.
Sorry about the loss.
And thank you, Amy, for sharing your story, and sorry about that also. We also had kind of a similar question to that. I think Veronica, she wanted to know if someone did ingest chemicals, but they didn't know exactly what chemical their child had maybe ingested. Would the Poison Center be able to figure that out?
Possibly. If they could narrow it down to the type of chemical, like was it like a liquid or a powder? Is it used for like the bathroom, but the toilet, the sink? We might be able to narrow it down. But if there's any uncertainty, beyond our comfort level, then we would probably recommend an emergency room visit.
Okay, sounds good.
It really depends.
Okay, sounds good. And then,
Is,
oh, go
is,
ahead.
is Ipecac still recommended for parents to have on hand?
No.
Okay.
Yeah, that's really good to know. And I don't know if a lot of people know that, because that was always the go-to thing. You always had that in your medicine cabinet, right? So I think getting that information out would be really important.
Yeah, and if I can also just add quickly, so Ipecac is not recommended, but also like trying to induce vomiting. A lot of people call, thinking, the immediate thing to do would be to like induce vomiting to try to get the toxin out of their system. But we don't recommend that because the vomit could get into their lungs and cause more problems. So we don't recommend inducing vomiting. And again, we don't recommend Ipecac anymore.
And another question from Ty. This could be for you too, Becca. So how does consistent exposure to cigarette smoke differ from marijuana smoke, if at all?
I don't have a good answer on that one. I think that the research is still ongoing and we're still looking into what precisely are the differences. But what seems to be a factor is just smoke in general, that heated, non-oxygenated air that's causing issues and troubles. There's some really amazing literature out there that can look through like the number of cigarettes and what proportional increase in risk for SUID exists. We don't have the same kind of literature for marijuana exposure related to SUID risk, but I bet that's going to come out in the next several years based on all of the medical and recreational legalization that's happening around the country. But it's right now, the important message is all smoke of any kind. If there's any kind of smoke and you have an infant or you're pregnant, that is a risk for sudden unexpected infant death.
Thanks, Becca.
And Becca, I also always add that, after showering, changing your clothes, one can also wear masks if you go into care for an infant.
That's a great point. Absolutely. Absolutely, because you could have it on your breath and still have that exposure. And a lot of what we're seeing right now with the marijuana exposure cases is more related to guests going to someone's house and that person has children. So not necessarily the caregiver themselves who's using marijuana or has marijuana on the premises, but it's, someone comes over and they leave it out, they leave it in their purse, they leave it wherever the child accesses it, and it results in an unintended exposure. So another thing to talk to families and caregivers about is talk to people when they come into your home. Say, hey, if you have any marijuana, no judgment. Can I put it up and out of the way so that my kid doesn't accidentally find it? Or if someone is going over to another person's house, same thing. And it's a similar conversation that we encourage for gun safety as well. If you have any marijuana products, no judgment, totally cool with that, but I want to make sure my kid can't access it. Can you just make sure that that's locked up away? Because my kid's really curious, loves to eat, and is going to get into anything that they can. And just really making sure that that is an open line of conversation. And again, without judgment, just taking it from a safety standpoint for that young child.
Okay, well, see if anyone, I think we got through all the questions in the chat. But yeah, thank you everyone for coming. I hope you guys were able to learn a lot. If you guys have any other questions, just email me, or if you need a more specific training for anybody, just let me know and I'll be happy to do it. But thank you guys, and we will see you next time. Thank you, Jeff.
Can I say
Thank
one
you,
last
everyone.
thing?
Have a great day.
Sorry,
Be
Jeff.
safe.
Go ahead, yes.
I was just going to say, please feel free to call Poison Center anytime. We're a 24/7 center. All the time we're open. And if there's any doubt, feel free to call us anytime. It's better, safer than You want to be safer than sorry. So give us a call anytime.
Yes. There is also an evaluation link that will be sent in the chat and also an email followed up with the evaluation link and the slides from today's presentation. These evaluations help us improve these trainings. So if you have the opportunity, please answer the post-evaluation survey. And then we do have next month is the child passenger safety training. If Emily, could you please also put that link in the chat if you would like to register for that? I believe it is August 10th. And that is again, child passenger safety. So thank you so much for joining us today. We really appreciate it and hope you all have a wonderful day.